I look like a fucking crazy witch lady. Good enough. Hi there, my name is Natalina, and I'm a mental health therapist. And I'm here today with my friend Serb to talk a little bit about ketamine.
Hi, SM Cerberus, street medic extraordinaire. According to the National Registry, I am EMT certified, so I guess I'm official.
Yay! Congrats!
So, ketamine.
What is ketamine? Can you explain a little bit what it actually is?
Sure. So, so ketamine is categorized as a dissociative anesthetic. It can, when it's administered, a medical professional, when they administer it to a patient, they'll calculate the dosage based on the patient's weight in kilograms, and based on how much is administered, it has a couple of different effects on the patient. So in low dosages, which is typically the 0.1 to 0.3 milligrams per kilogram of the patient, it's a really useful pain management option. When you increase the dosage, so usually between 0.5 milligram to 1 milligram per kilogram of your patient, that's kind of your party range.
Party.
So it'll be
Like the happy, fun, woo, things are dissociative and weird.
And hallucination, and yeah. I think you've said that that's referred to as the K-hole.
Yeah.
I have to show my nerd card and be like, oh yeah, I'm all about ketamine. What's this K-hole?
It's a drug thing. It's fine.
Yeah, I know, I'm a square. Anyway, but at any rate, so yeah, with the dosages, basically once you cross over 1 milligram per kilogram, it becomes, you can either describe it as a chemical restraint or as a sedative. So basically, once you cross that 1 milligram per kilogram threshold, the patient is completely dissociated. So whether a medical professional is using the ketamine in order to perform a procedure or just to restrain somebody, like I said, that dosage is 1 milligram per kilo at least.
So if we were to put that into kind of different numbers, say if you had to sedate yourself,
right?
How much ketamine would be required to do that kind of easily?
Right. So if I or anybody else wanted to totally just put me out, depending on what day we're talking about, I'm 90 or 95 kilos. So if somebody were to draw up around 100 milligrams of ketamine, that would put me out. I'd be fully dissociated.
That seems like not that much. So
it's not. It's really not. It doesn't take very much ketamine to work. And for that matter, again, from the clinical side of things, it's part of the appeal of ketamine is that, so let's say I'm working on the ambulance and I want to relieve somebody's pain, so I give them that that low dose of ketamine. It's going to take full effect in 90 seconds to 120, so in under 2 minutes.
That's instant gratification, basically.
It really is. It really is, and especially when you compare it to other pain management medicines that can take up to 20 minutes. Yeah, ketamine, it's pretty awesome because of the speed. Plus, it's got a couple other benefits. So it'll boost BP a little, or it'll boost blood pressure a little bit, increase heart rate a little bit. It will also increase myocardial contractility a little bit. So basically, in all of these things, the medicine speak, if you've got somebody who has suffered a major trauma, so they've got something sticking out of a place it's not supposed to be sticking out of, whether that's a bone, piece of metal, if they've lost a lot of blood, all of those things, you can treat them very effectively, right? The boost in BP,
Right.
the boost in heart rate, the boost in the contractility, those are good things.
Right, you want your heart working extra hard when you've lost a lot of blood. You want that
Right.
blood pressure up so that it can get to the places it needs to get.
Right, and that's kind of the emphasis. Just as talking about the medicine itself is really cool. I already said I'm a nerd, right? And from that perspective, ketamine is really, really cool. And the problem is, where do we then go from there, right?
Right, it seems like, and let me know if I'm wrong here, like there's probably a pretty significant difference between what ketamine usage is looking like in the clinics with procedures, and then what it's actually looking like kind of in your field where you're working, it could be in somebody's living room with a bunch of other people around.
Yeah, absolutely. So, and to kind of further that distinction, right? If you're in the hospital setting, doctors getting ready to do a procedure, so they usually will blend the ketamine, so they'll use whatever the dosage is for the dissociation, and they'll blend it with a couple other things like Versed or there's a couple other options that might be used, but those are all actually good things, right? The blending of the medication helps it so that when somebody's coming out from the sedation, it's a little easier, right?
They're not as dissociative? Is that kind of what it's going for?
It's a gentler return, right? So you'll avoid some of the hallucination. Somebody who's having a procedure in the hospital, they don't.
You don't really need that.
Don't really need that.
No.
But in contrast to that, what you're saying, in EMS talking about when you're out in the field administering ketamine, you've got somebody on their living room floor, you've got somebody on the sidewalk or whatever. It's a much different environment. To say the least, it's a high stress environment for everybody involved. But of course, as was already referenced, this is where things get a little weird.
Yeah.
Part of the reason why we're talking about this today is because we do want to kind of highlight, there's been some controversy with ketamine recently. And so that's kind of what we're looking to talk about.
So can you talk a little bit about when ketamine goes wrong? What things happen that maybe make ketamine dangerous or ineffective or not the right tool?
Right. So the biggest, so to kind of start from the clinical stuff and go into it, right? So ketamine, it's cool because you can use these dosages. You're not going to run into overdosing is not a thing with ketamine. The more ketamine that you use, the longer it lasts. Right?
So you don't have to worry kind of in the same way that you do with opioids and other stuff.
Right. So when it starts going wrong though is, you use the maximum dosage, right?
Okay.
So let's say we're, on the sidewalk, right? And you've got somebody who's in an altered state of mind, right? They're being disruptive. Somebody calls the cops, and they say, "Yep, there's a crazy man on my sidewalk. Come and get him." Something
He's being weird.
Right.
Come fix it.
Right. There's this thought process amongst, cops and some paramedics. Well, if this person is being disruptive, combative, if the description is excited delirium, they might just hit this person with the ketamine and use the maximum dosage because they know it's not going to cause an overdose, it's not going to cause an allergic reaction, so we're just going to use the maximum dose. The problem, right, so what we're driving at, ketamine is supposed to be used as a slow push, right? So you draw up your dosage and you administer it slowly. So let's say you administer it over the course of a minute or two, and then it takes another 2 minutes to take effect. When you're in the hospital, that's not a big deal.
So you're literally pushing for like a minute.
Yep. But meanwhile, if you're out on the sidewalk, like we said, tensions are high, to say the very least. And so there becomes this pressure of like now, the instant gratification that you
right, get it done now.
So you've got, sometimes you get medics who will hit somebody with ketamine and they'll hit them hard. And this is where problems start to happen. When ketamine gets administered too fast, it can cause apnea. And so, again, in a hospital environment, or just simply when medical professionals are in charge of a situation.
Right, it's more controlled.
Well, and the medical professionals should be tracking that this apnea is a possibility.
Right? And watching their respirations.
Right, exactly. Keeping track of all of that stuff. Monitoring your patient as we're trained to do. Right? So when you have these cases where, the pigs are like, hit him with the ketamine, and the medic is like, okay, and just hit him with the ketamine. Yeah, hit him hard, and they go apneic. If the cops are taking charge of the situation, they're not monitoring for that apnea, right? And there's documented evidence that this is a problem.
And I would guess, like, the position the person is in might make a difference too. Like, if the person is like on their stomach, and they've been hit with, maybe the full dose of ketamine really fast, and they stop breathing. Yeah, it's going to be, really difficult for a medical professional to see that they're not breathing unless they're actually really right up next to that person.
But the emphasis there is that that's what's supposed to be happening. Once you use a medicine like that, medical professionals are supposed to be monitoring the individual as a patient, right? So let's go into some of these case studies.
Yeah.
Right? Like everything we've referenced there's all documented cases where like these
this
things
has happened.
Yeah, and we're talking specifically like here in the Twin Cities. This is stuff that has happened. So just right off the bat, talking about these situations where you've got police and paramedics who are supposed to be working together in the interest of public safety, and that doesn't quite happen. There is actually a current situation where there was a paramedic in Woodbury who got pushed out of their department because they were a whistleblower. So this was published in August of 2020. The paramedic was saying, dispatch would call the medics and be like, hey, bring your ketamine. The paramedic has referenced at least 4 different instances where the cops told the paramedics to use the ketamine.
Right, and then he felt it was like a really pressuring environment. And then wasn't he like put on a disciplinary plan essentially for saying that?
Yeah, for speaking out, he was put on a disciplinary plan or a professional development plan, whatever it is. But the thing is, the person, he just kind of stood his ground, right? In terms of, no, I don't want to use ketamine if that's not the appropriate thing.
Right.
Let me talk to the patient. A lot of the times. Yeah, I mean, you're the expert here.
How can you see a patient and not talk with them? How
Right.
can you do any sort of assessment without actually asking them what is going on, trying to do that assessment with your eyes and your ears? Like, that's why we go to school. It's why we do our training.
Right. And those principles still apply in the world of EMS, right? I've had it where I've had patients who are agitated, and you just talk to them like a real person, and maybe it doesn't necessarily solve all their problems right then and there, right? But at least they're like, okay, yeah, let's go to the hospital, let's get you checked out. As opposed to rolling up on a scene, the pigs are like, draw up your ketamine and hit them, and you just fucking do it, So, and that's what happened with this Woodbury paramedic, where he insisted I will use ketamine when it is appropriate, not when the cops are telling me to do it.
Right, which seems like just restating medical ethics of like, I will use the medication when it's medically appropriate.
And using all of your tools in the first interest of your patient, right? As a medical professional, your patient needs to be kind of the focus of your attention.
Right, and there's also this thing in medicine about like not jumping to the most invasive thing possible.
Right,
like,
yeah.
you know, surgeons maybe like doing surgery, but they don't tend to like go for the most extensive surgery possible if
Right.
they don't have to, because that's just not medically appropriate.
Right. And even the ambulance agency I work for has a kind of a stair-step approach to it like that, where based on the behavior of the patient kind of determines what you're going to be using. But yeah, you're supposed to start low and work up to it. You're not supposed to hit somebody with the strong stuff right off the bat. And you know, there's all sorts of, so obviously Woodbury here in the Twin Cities, this sort of situation where the cops are telling the medics what to do, that's also what happened in the Elijah McClain case, which actually has been, recently it's been reviewed, because, let's see, when did this one?
That was really recently reviewed.
Yeah,
right?
well, the report that I found came from EMS World on Twitter, and it was just a day or two ago, I think it was. Maybe we can link to the article.
Yeah, we'll put a link to all the articles that we talk about.
But yeah, so but Elijah McClain, somebody called the cops and said there's a suspicious person. So the cops,
AKA a black person.
Right, exactly. So the cops roll up, tell him to stop walking. He says, no, I'm not going to stop walking. They end up throwing him down, choking him out.
Which legally, he doesn't have to stop for them. There's no probable cause.
Right. Somebody said that he was suspicious.
That doesn't mean anything.
Right. Well, and but the cops agreed with it, which therefore makes it real.
Right.
Fuck 12. Anyway. So the cops have choked him out, handcuffed him, paramedics rolled up, and again, the cops just said, hit him with the ketamine.
So I say do it. Do it, do it, do it, do it, do it.
And they fucking did it. And so the review that I was looking at actually pointed out that those paramedics never did their own assessment.
Oh.
Right? Which is, among other things,
That's horrifying.
Case. Right, yeah. That's not the way it's supposed to happen. You know, as a medical professional, as a paramedic, EMT, once you take charge of a patient, you have to do your own assessment, if nothing else, just to verify what other people have told you.
Right, and it's not even like they were getting information from another medical professional.
Right.
They were getting information from the cops.
Yeah.
They can't assess anything medically. They can't tell you anything. You need to do your own assessment because you're the medical professional on the scene.
I know. And that's one of the things that really kind of gets me worked up, because this does happen often where medical professionals are taking the lead or letting cops take the lead.
That doesn't make any sense.
Yes. You are right. Another case that happened here in our area, this one didn't actually include the use of ketamine, but it was the positional thing that we referenced earlier, right? This was a year ago. So this case that's here in town, Ramsey County deputies had responded to a scene where there was an individual who was having an episode. Her name was Nakia Moody. She had checked herself into inpatient mental health services something like 7 times in the month or two preceding this event.
So existing mental health stuff. I believe she had a diagnosis of schizophrenia, of a thought disorder.
Yep. And so when the Ramsey County deputies were called, she was having an episode. She was not oriented, right? She was calling out for her kids. She was talking about things that weren't there, you know. But what ended up happening is that the deputies, in trying to subdue her, flipped her over onto her stomach. One put his knee on her shoulder, and the other one put his knees on, I think, the back of her legs or something. Yeah, holding her down, and then they handcuffed her. And pretty soon thereafter, she went still. And so we can link to this one too, but there's a video with it where the deputies are talking back and forth, and the one keeps saying...
Pretty disgusting.
It's really disgusting. Especially because the one deputy keeps saying, I think she's just playing possum, right?
How can you can't just stop your pulse.
Right. Well, but it's not like the deputies, like, they're not medical professionals. Like, the one is asking the other guy, like, hey, does she have a pulse? Can you find the pulse? And he can't fucking do it.
Because you don't know what the fuck you're doing.
Right.
You're not a medical person.
Right, and that's the whole thing, right? From a medical perspective, if you let a person maintain their own airway, so like in that instance, if they had just sat her up, she would have been able to maintain her own airway, she would have been able to breathe just fine, but with two adult males on her back, she has trouble breathing.
Shocker.
Go fucking figure. But yeah, so she had stopped breathing prior to paramedics arriving on scene. They get her out of the house, get her into the ambulance. She went into cardiac arrest on the way to the hospital and ended up passing away. But, you know, like I said, this is not a ketamine case, but it is a case to reemphasize that the cops don't have that kind of medical
knowledge.
Training. Yeah. And it should be, like, as long as you have medical professionals responding to the scene, they should be in charge of those medical considerations.
Yeah.
So whether it was Elijah McClain, Nakia Moody, you know, the paramedics should not be taking the lead or accepting the lead of the cops.
Right. Like, I don't understand why in that case there wasn't, you know, more medical attention. Because, you know, if you're having a psychotic episode, that's a medical event, really. And she needed medical treatment. And, you know, this is maybe a good example of a case that could have been avoided altogether with kind of some proper mental health responders, right? Because I don't have any problem, you know, talking with somebody who's maybe disoriented and maybe seeing things or hearing things, right? Like, that doesn't mean that they need to be subdued. We can still have a conversation, and we can still maybe figure out how to, you know, get that person to the hospital of their own accord without, you know, using any kind of chemical restraint. And it just seems like that verbal attempt wasn't probably made.
Right. And unfortunately, I wish I could say that wasn't a trend, but very often, like with the cops, anytime they see, well, when all you have is a hammer, everything looks like a nail.
Yeah.
You know, where they want to go in and they want to take control of the situation, they want to neutralize threats, they want to do this sort of shit, and it's like, but the thing is...
They want to be an operator.
Right. Yeah, exactly. Be super... operator, G.I. Joe, whatever the fuck, right? But in cases like this, you don't need to hammer a nail. You know, you've got somebody who just, you try to connect with them, try to encourage them to come in for, you know, for help.
Right, like, she was willing to go to receive mental health care in the past. To me, there's no reason why she wouldn't have likely been willing to go again, and, like, if asked.
Right. Now, to use another example, right? If only it were as simple as the cops are shit at dealing with mental health, right? But it's all kinds of medical emergencies. There's another example from this one, Minneapolis PD. The article was published on the 3rd of August, 2020. The event was in July. So the individual who was having a medical emergency, his name's Max Johnson. He type 1 diabetic, right? So his whole life he's been having to take insulin to deal with his diabetes. Again, unknown quantity, right?
He's with his girlfriend, who also knows that he's diabetic, also is very familiar with caring for his diabetes generally.
Right, exactly. And so the story is that so Max was sleeping on the couch. Abby comes out, sees that he's having a seizure. Since the two of them are kind of on the same page, she knows that it's a hypoglycemic seizure, which is, it's not out of the ordinary.
It's
right?
a thing that happens with type 1 diabetics.
Right, exactly. As a medical professional, hypoglycemia is a pretty common thing. Maybe not the seizure piece of it, but be that as it may. Anyway, the point is that so her boyfriend is having a hypoglycemic seizure, so she calls 911, asks for help.
And she says that's what it is on the 911 call.
Yep. But then when 911 response arrives on scene and he comes out of the seizure, they report that he became combative.
And just to say a little bit, like when somebody comes out of a seizure, they're in this what's called a post-ictal state, and it's really common for people to be disoriented and confused, and to kind of act in an erratic way. So this is not uncommon for somebody in that medical position at all.
Right. Again, it's par for the course. It's a known quantity. But anyway, so I don't know if I actually said it, but Hennepin County EMS, they were the first ones on the scene. So they were there when he came out of the seizure. They report that he becomes combative. So PD, the Minneapolis cops,
show up.
Yep, and they hold him down and all this sort of stuff. And ultimately, what they did is they administered 500 milligrams of ketamine and 20 milligrams of Versed. Again, that 500 milligrams of ketamine, to fully dissociate someone my size takes 100, right? And no, this isn't an overdose thing, but it is a thing of like 500 is going to last a really long time, so someone is going to be restrained for a really long time with that much.
And then the extra, would that also kind of make it longer or more intense?
It should just lengthen the time of the restraint. Additional ketamine doesn't like make it work more, just longer. But at any rate, so I will grant that was probably a very tense situation. So the ketamine was probably administered very fast. But end result there was that Max Johnson, he ended up on a ventilator and he was in the ICU for 2 days, which should not happen for hypoglycemia.
No, I mean they knew what the issue was, and wasn't there like a delay in giving him the glucagon, or that it was oral versus? The paramedics had been on scene for 7 minutes before they tried to administer that oral glucagon. But again, from that medical perspective, somebody who has just come out of a seizure, you don't want to assume that person can swallow something. Yeah, that would be a weird assumption, right?
Right. So if I were in that situation and I had somebody who had just come out of a seizure, I would try to establish an IV and administer it that route, which I know, if you have somebody who's post-ictal, that presents another issue.
Yeah, that could also be, but
I'm not. Yeah, they waited 7 minutes before they tried to administer the oral glucagon. So, yeah, that's a situation that it brings up a lot of questions.
Right. It just seems like very messy, and like it probably could have gone a different way. Like I remember reading Abby's post about it right afterwards, and I remember her talking kind of about like how many cops that there were, and that she felt like her whole living room was just like filled up with people, and like I don't think that really must make a very conducive medical environment.
Right. Yeah. Yeah, a lot of time the cops talk about coming in with an overwhelming use of force, which just goes back to that whole thing. When all you have is a hammer, everything looks like a nail, right? They want to overwhelm the threat. They want to neutralize the threat. And it's like, there is no threat. It's just somebody who had a hypoglycemic seizure.
Right. And it's just like, that overwhelming use of force, that's America's foreign military policy, like officially. Why are you using that on community members, right? Like we're not the enemy, and it just sort of like speaks to that like warrior mentality that seems to really like permeate and make this really toxic culture that is about like punishment versus actually providing like services to the community.
I feel like that's another whole discussion about militarization of the police.
Yeah.
Yeah, ketamine, it's not a bad thing.
Right, and it's almost like frustrating to see like how like quote unquote good a drug it is. Like it seems like a good drug. Like people aren't allergic to it, you can't overdose on it. Like the ways you can like fuck it up seem relatively small and like they would be easy to avoid.
Right, it's again, the known quantities. We know that if you administer ketamine too fast, that it causes apnea. So either you watch for it, or you administer it slower. Yeah, there are no issues of using ketamine in the hospital environment. Yes, it's a controlled environment. I get that, but I don't feel like that's an excuse for misuse of it. In people's homes and on the sidewalk and in the community.
Right. Well, I mean, like, all of your job as an EMT is working in unknowns.
Right, yeah.
Like, if that was an excuse for things to be bad, like, that would be terrible.
Right, yeah. Yep. I personally, so I'm, all my opinions are my own, right? If the environment that I worked in was truly as hostile as some people make it out to be, I really feel like the job would be a lot different.
Yeah. That makes sense.
Yeah. So.
Well, I really appreciate you kind of explaining this about ketamine and how it gets used, and I think it's really helpful information to put out there, right? Both of like, okay, here's how it should be, so that you can tell when it's going really badly, and that we can maybe make some changes, because it just really isn't fair to have people who aren't medical professionals trying to like usurp medical professionals and make those decisions when they don't have the knowledge to do it safely.
Yeah. And that's a big issue, and I'm going to kind of take that as an opportunity to pivot a little bit. That the reason why we're having this conversation in the first place, dear friend of ours, Kirby Deathridge, had actually initially brought up this topic as an idea for conversation. Unfortunately, Kirby passed away at the beginning of February, and so it leaves a hole, but yet what we're trying to do is really trying to honor Kirby by continuing this and having the conversation, and bringing awareness to exactly the topic as you phrased it.
Yeah, and Kirby was just a wonderful person, a wonderful medic, wonderful human being, and we will include a link below for a fundraiser for their memorial, and there's going to be kind of some funds going towards projects that they were working on.
So
awesome.
Yeah.
Thanks for joining us.
Yeah, absolutely. Yeah, I love the opportunity to nerd out.
Awesome. And we shall nerd out about more stuff in the future. Pew pew.
Finger guns.